All right, guys, so we're talking about the chemical hygiene plan. And we said that you are not covered under the CHP. Only employees of an organization are covered under a CHP. So if you are a work study student, then you would be covered. But if you're just a normal student taking a class, you're not. Again, this is falling under OSHA, which is occupational safety, and that only concerns workers or employees. So we need to talk about this CHP. What should be included in a CHP, this safety plan that we should be following as an employee of an institution? Well, there's a couple of major sections that OSHA would like for you to include, and these are kind of a requirement, okay? These are components of a CHP that are required or at least heavily suggested. And these components are coming from the Code of Federal Regulations, 29 CFR 1910-1450, Section 3. So what do they look like? Here we go. So what I want to do, I just kind of want to go through this list and just kind of want to read them out to you to make sure that we fully understand what should be in a CHP. And again, up here at the very top, I'm going to put kind of the requirements or the regulations that really enforce this. So 29 Code of Federal Regulations, we said 1910-1450. And this is specifically in Section 3. Okay. So up at the top, we're going to see standard operating procedures involving the use of hazardous chemicals. Standard operating procedure stands for SOP. So basically, if I'm using a hazardous chemical in the laboratory, how should I be handling it? That's the standard operating procedure, right? What should you do? What are the steps that you should do it in? How should I end up? That's what we call a standard operating procedure. Directions. So think about the back of a cake box. The back of a cake box will give you directions. Step number 1, preheat your oven. Step number 2, mix the ingredients together. Step number 3, put it in the oven and bake it. And step number 4, take it out and let it cool. That's the standard operating procedure. That is the SOP to make the cake. We also need SOPs for hazardous chemicals. Number 2, criteria to determine and implement control measures to reduce employee exposure to hazardous chemicals. Okay, so basically what this is referring to is how do you lower the exposure? That's what we're after. If you're going to use them, and there's no way around it, how would you make sure that you are not exposing yourself to unnecessary exposure limits? What are the steps that's going to do that you're going to take to put that in place? Number 3, requirements to ensure control measures perform properly. So the control measures that you are introducing up here to limit the exposure, how are you going to make sure that those are working? How are you going to make sure that those are getting implemented? If you're going to take the trouble to tell us what you're going to do to prevent it, well, how are you going to back it up? How are you going to say that these have been done and these are implemented? Next, employee information and training. This is probably the one that gets most people. Number 4, as an employee, I should receive training, proper training about exposure, especially with hazardous chemicals, right? And if I receive that training, it has to be documented. I have to prove to someone that we did provide training to the employees. So that way the employee could say, I never got any training. They never told me what to do. They never told me how to handle this situation. Because if your employees begin to tell that type of story, someone's going to be in trouble. Number 5, operations requiring prior employer approval. So, operations basically means things that are getting done in the lab. Is there a document or a paper trail in place that basically has said, yes, you can do these things. Yes, you can handle this chemical. Yes, you can do this experiment. And where did it originate from? Who gave you permission? Number 5. Number 6, medical consultation and examination. All right, so what if something happens to an employee? Where do they go? Is there a doctor or a nurse on site? Do they go there first? If so, who's the person's name? What do they do? And you have to ensure that they keep those medical records on file. If the person goes to a hospital or a clinic, what did they say about them? What was the report? Those have to be kept on file because they can be reviewed. Number 7, designation of the chemical hygiene officer or officers. Okay, so this company, if they're going to have a chemical hygiene plan, well, they're going to have a chemical hygiene officer. So who is it? What's the person's name? What's their contact information? What goes on? That way, if someone comes to the site and they begin to find problems, they can contact the CHO and say, listen, we've got questions and we want to know why these things haven't been done or why these things are not proper. Number 8, requirements for handling particularly hazard chemicals. If there's really nasty stuff that we have in the laboratory, we have to identify them. And not only that, but we have to identify how we really do handle those. So what steps are we taking for employers to make sure that they're not getting drastically poisoned by this really super hazardous chemical? Number 9, designated areas. Designated areas basically means where can the work be done? Are clean rooms involved? Normal lab spaces involved? Is this hazardous chemical only housed in one location at the employer's site or academic institution? If so, where is that location? How can you prove that it never leaves? Number 10, containment equipment. That basically means what kind of things are you implementing in place, like a clean room or a vented hood, that's allowing your exposure to be minimal. Number 11, procedures for safe removal of contaminated waste. All right, so if I am using a hazardous chemical and I'm through with using it, I've got some waste, maybe some leftover or unused stuff, or maybe the reaction produced waste that's hazardous. So number 11 is going to say, well, how do you get rid of it? What steps are you taking? As an employee, what are you doing with that waste? Where are you putting it? Where is it getting stored? What's happening after it leaves your hands? As an employer, well, now that this waste has been given to you by your employees, what are you doing to make sure that it's leaving the site, it's leaving the room? And number 12 is decontamination procedures. If something happens in the laboratory and a hazardous spill goes on, how do you decontaminate those areas? Who does it for you? Is there certain things on site that you have to basically be aware of? And are those chemicals, if they get spilled, are they being handled the proper way? And how are you ensuring that the area is decontaminated before you allow people to go back in and continue to work? So these are the 12 components of a chemical hygiene plan, right? And think about it, chemical hygiene. Basically involving hazardous chemicals And how can we ensure that everything is staying clean for a worker? Hygiene, right? We don't want your exposure to happen. We want it to be minimal. If something does happen, how can we clean it up? Those are the things that the CHP will focus on. And one person or a group of people, known as the chemical hygiene officer, should be in control of this document. All right, so those are the 12 things that's going to be kind of a requirement for a CHP. So at this point, I'm going to stop the video, and in the next video, we're going to continue on. And we're going to talk about the CHP in a little more detail, talk about some of the components that you might see on the inside and how it should be organized and where you should be able to find it. And we'll just keep trucking on throughout the CHP world.